My name is Dan Jung with the MBhealth Insurance Agency here in St. Louis, Missouri. Today I want to talk about dental insurance and how much should you pay? Well, that's a question that I get asked quite a bit whenever I'm dealing with any form of insurance, because your budget is really important, not just for an individual, but also for a family. And then what is it that I need the plan to cover, okay? And when it comes to dental, you've got preventative care services, you've got basic, and you've got major. And different carriers lump things in there a little differently. And so it's really important that you're talking to a consultant like us to make sure that you're getting the most out of the plan you select. So let's talk about the network piece for a quick second. There are PPO dental plans, there are HMO style plans, and it really depends on where you're at, where you're located, if you have a current dentist, and if you have no dentist, but then that changes all the options. A dental plan is only as good, no matter what the premium is, if the dentist you go to is covered. Because a lot of people do not change their dentists. They'll change a primary care physician sometimes sooner than they will their actual dental provider. So the premium can play a bit of a factor when I'm trying to find the network that fits best, okay? You've got United Healthcares of the world or Delta Dentals of the world, and multiple carriers that do different things or specialize in different products have higher annual maximums that cover more throughout the course of a year. So that's kind of how I approach it when we talk with customers for dental. Do you kind of know you have a lot of dental issues? Do you have cavities? Do you know that you might have root canals on the horizon? Or could you be looking at implants? Those are great questions to be talking about because that's going to determine that premium. If I go for a plan that covers implants, we certainly are going to have a higher priced premium. If we need a product because I have children and orthodontia could become a benefit needed, that's going to change the premium. So we're really careful when we consult on the best product that's going to make sense for you. Because, you know, the worst thing that you could do is have a dental plan, have a service, and then it not be covered. Knowing if you have waiting periods is kind of like the last thing I always talk about with clients. I hate to wait 6 months or 12 months to use my plan, but I sure better know which services that could entail so that I don't end up paying a premium and getting nothing for my policy. That's extremely frustrating. And you could be coming off a plan, and that plays a big factor in what we look at as well. Maybe you're leaving a Delta Dental plan and we want to stay with Delta Dental on the individual. So there's a lot of questions that kind of come into play, and you need to be talking to somebody. Doing things alone isn't always the best answer. So look us up here at MBhealth online at mbhealth.com or give us a call at 314-544-5400. Take care.